And now I'd like to introduce my co-chair, John Sculley, who will share with you why we need a promise fund in our community. Thank you, John. I don't know if you need this. Yes, I do. Yes, I could. Careful. Okay.
Want your phone? Well, thank you, Paulette, and thank you, everybody, for turning out. And thank you, Nancy Brinker, for you and Lori Silvers and Julie Fisher Cummings were the original founders of the Promise Fund. And I think it's really well-timed with what has been accomplished so far and what we can do in the future. So I'd like to give you some context, because Diane and I have been involved with healthcare for over a decade. We've been investing in transformative healthcare companies around the country. And there's some lessons learned that I think give us real encouragement that what Nancy and Lori and Julie founded really has legs, that we're just at the beginning of what is possible. So the good news is that early detection of breast cancer can save lives. The not so good news is that in Palm Beach County, there are no nonprofit hospitals. And in Palm Beach County, or really state of Florida, there is no real path of government funding that can particularly deal with the types of issues for women who do test positive for breast cancer to be able to get the kind of care they want, unless we have an organization like the Promise Fund. So the context I would like to share with you is that there is a transformation going on in healthcare. Healthcare is a $4 trillion industry in the United States. 85% of the spend in healthcare of that $4 trillion is for sick care, chronic care diseases, high comorbidities. But 70% of that 85% is reversible through types of things we can do, better behavior by people who are sick, preventative care, but it's particularly a big opportunity for people who have been detected with breast cancer at a very early stage. So the good news is that with our Found Care partnership and the MRI mammogram machine that is able to do all of this terrific testing for early stage breast cancer, it works, the evidence is clear, and the challenge is, particularly for the poverty level population in Palm Beach County, there are about a little over 80,000 women who fall into this classification of $26,000 family income for a typical four-member family, and they do not have the money on their own to be able to deal with it. So here they are. They find out through early detection that they may test positive. I think out of the 12,000 people that have been tested, we have something like 65 of them have actually tested positive. So the challenge is, how do we get them the care when they don't have money? How do we educate them when they don't know much about health care and what is possible? And how do we connect them with the medical professionals that can actually help them? So what the Promise Fund has done is not only prove the science that early detection can save lives, but the Promise Fund has organized at a community level. Now I can tell you that in the healthcare industry broadly, that it used to be that hospitals were doing most of the care of patients, and you would go into a hospital for a procedure and you might be there for 3, 4, 5 days or even longer. The typical patient in a hospital now is an outpatient experience. They're in and out, even for surgical procedures, they're in and out very quickly. And so the whole model of what is a hospital is changing around this country. And it's because of the advantage of new technologies like digital health, virtual care, the ability to start to even give patients information that they never knew before about themselves, that the point of care is now moving from inpatients in the hospital to outpatients that may be cared for in their own communities. This can mean aging in place at your home. It may mean assisted living. It may mean healthcare at retail. If you watch what's going on at CVS and Walgreens and Walmart in terms of the types of healthcare services they're putting in place at retail. So now coming back to what is specialist care, because ours is not just primary care, but it's specialist care where we have to have access to radiologists, to chemotherapy, to be able to deal with medications and evaluations, transportation for these people to get to where they have to go. All of these things require organization. And what the Promise Fund has done is they have two functions that have been proven that they work and they scale. One is aggregation, being able to aggregate together relationships with the various medical professionals in Palm Beach County. Remember, there's an 80,000 person population of these women at the 26,000 or below income. And then we have, in addition to the aggregation role, we have the navigators. Now, the navigators in healthcare are nurses, or they may be social workers. They get training for what they have to do, and they can go out to populations that we're dealing with, which may not know a lot about healthcare, but they're dealing with a crisis situation if they are testing positive that has to be dealt with, and they can explain to them and build confidence that they can have a relationship with them. So our population tends to have Haitians, Afro-Americans, tends to have Hispanics, may have Jewish populations, many different ethnic and demographic groups. So we draw the navigators at the Promise Fund from the same population. And they are trained with the skills to be able to build confidence with the people they're dealing with. So we're aggregating, on the one hand, the relationship with the medical professionals that we need in Palm Beach County, and we are navigating, meaning advising, educating these women. So now when you look at where we are today, the Promise Fund has proven the science that evidence-based measurement with mammograms at an early stage can save lives. Without what the Promise Fund is doing, for many of these women, is a death sentence. Because if they wait till a later stage and they don't treat it, breast cancer is one of the most serious cancers that you can have. So where we are with the Promise Fund is we have proven the case that we're ready to scale. We have the leadership in the fund. All of us know Nancy Brinker, and the team she's put around her is just amazing. Everything Nancy has done in her life has turned out to be consequential. I mean, she is not only a great woman, she's a great American, and we're lucky that Nancy decided to take on this leadership. So I'll just leave you with one message, and I know Nancy will probably take this through in a little more detail, but we need the wealthy people that all of us are part of here in Palm Beach to step forward and bring in the contributions and the type of money that we need to scale this. We can scale this where we can test all the women, 80,000 in Palm Beach County by 2024, but we can't do it without stepping up the amount of money. So this is about investing in something that can save lives. If you look at, I'm involved with cell therapies for cancer for people who are seriously ill with various cancers. And if you can save a small number of people or even extend their life by a few months, that's considered a success. We're talking about saving people's lives with early detection, that they can live a healthy life and continue being a part of all the members in their family and their lives too. So it's a great organization. It's got great leadership. It's got the evidence that it works, and it fits into the community-based health, which is the healthcare system that we're going to see in the United States more and more. Focus on the patient as a customer, bring in modern technology that can do more things at different points of care, and be able to draw on resources that more and more are able to give people a better quality of life, at a lower cost. But it's got to scale.